Welcome to this brief overview of our paper on the impact of adverse events on patients' health-related quality of life at the end of multidrug-resistant tuberculosis in Namibia. My name is Sagwa. At the time of doing this production, I was affiliated to the Utrecht Institute for Pharmaceutical Sciences in the Division of Pharmacoepidemiology and Clinical Pharmacology in the Netherlands. Adverse events are common in multidrug-resistant tuberculosis treatment, which poses a huge challenge to patients and program managers. And it's not yet clear whether adverse events affect patients' health-related quality of life at completion of their treatment. So our aim was to assess the impact of medication-related adverse events on patients' perceived health-related quality of life when they finish their treatment. So we surveyed patients who completed 24 months of multidrug-resistant tuberculosis treatment, and we asked these patients to complete a simple questionnaire called the SF8 questionnaire, which comprises of 8 brief questions. 4 of the questions pertain to the physical component of health, and 4 other questions pertain to the mental component of health. We calculated their scores using a norm-based approach, whereby the mean was 50 and standard deviation was 10, meaning that 20 was the worst score and 80 the best score. We analyzed the association between their scores and the occurrence of adverse events. So what were the results? We found that the mean physical component summary score was 55.3, while the mental component summary score was 56.4, with some variability across the specific SF8 items as shown on the figure, implying a not so high self-rating of health by these patients. There was no association between the physical component summary and the mental component summary. Most of these patients, 89% of them, experienced at least one adverse event. The adverse events are listed. The good thing is that none of these adverse events were life-threatening. And there was no association between the occurrence of adverse events and patients' health-related quality of life scores at the end of their treatment. And we think that this was probably because some patients found the adverse events to be bearable, or that most of the adverse events occurred early during treatment, or that some of the adverse events were transient in nature and therefore resolved quickly, or that some patients had good supportive social systems. And last but not least, because of bias that is inherent in this study design, whereby we might have sampled some patients who were determined to go through their treatment irrespective of experiencing adverse events. So in conclusion, in Namibia, patients completing multidrug-resistant tuberculosis treatment tended to score moderately low on their health-related quality of life. Adverse events appear not to have contributed to the low scoring of the health-related quality of life by these patients, and we think that disease factors may play a bigger role instead. The SF8 questionnaire can be used for the programmatic monitoring of health-related quality of life in multidrug-resistant tuberculosis treatment for quality improvement. Thank you for viewing this brief overview. I encourage you to read the full paper on the link that is provided.